Welcome, everybody. I'm Dr. Sally Spencer-Thomas, co-chair of the Workplace Suicide Prevention Committee. This is our webinar on building peer supports in your workplace. It's my honor to introduce our two speakers today. Eduardo Vega is the CEO of Humanivations, and he is also a person with lived experience who consults and trains workplaces on best practices in developing peer support programs. Our second speaker is Ben Court. He is the CEO of Foundry Treatment Center in Colorado, and he is a man in long-term recovery who has a lot of passion for addiction recovery treatment and advocating for peer support in workplaces as well. He also is the author of a book called Weed Inc. This is part of the National Guidelines for Workplace Suicide Prevention, guidelines that were forged by a partnership among the American Association of Suicidology, the American Foundation for Suicide Prevention, and United Suicide Survivors International. The national guidelines are founded upon 8 guiding principles. And today, the guiding principle that we will be focused on is about empowered connection. The national guidelines are also comprised of 9 practices, upstream, midstream, and downstream practices. And today we'll be focused on the practice of developing peer support and well-being ambassadors.
The goals for today's presentation are to introduce you to peer support ideas for suicide prevention, present the basics of peer support in the workplace, and offer some first-hand experience on the value of peer support and prevention, as well as suggest starting points for creating your own peer support programs. Peer support is incredibly powerful. It's also affordable and it's easily accessed. It's a form of support in the workplace and in professional associations that can be pretty quickly and concisely put in place and has remarkable benefit.
So to start off, Sally introduced me briefly. I've worked in mental health, suicide prevention, and social services for over 30 years in various states and a few countries. And my passion for peer support, I really evolved out of partially my own lived experience, but then also a lot of the work that I've done in different places, like you'll see below in Fiji, where they had almost no resources and no money for mental health programs or psychosocial programs in the classic sense. And so the community got together. I was part of a project there and devised an entirely new kind of peer support approach and network to support the whole country. At the top, you see the Golden Gate Bridge, world famous, of course. I, for a few years in San Francisco, lived about 1.2 miles from the bridge. I know it's 1.2 miles because I am a runner. And so I would run to the bridge very often from my house. And one day I was actually working at home on this particular day. We had offices downtown. And I got a call from a friend of one of my staff people. And this staff person was also a friend in a lot of ways. We were very chummy. I was very much a fan of her work. Her boyfriend at the time rang me and asked if I had seen her and said that he was concerned about her because she'd been having a really rough time, struggling with a lot of suicidal intensity. And I hadn't seen her, but I texted her and she did get back to me and she said, I'm on the bus to the bridge. And it was clear from our little bit of text conversation that she was going to the bridge to jump off, which she had talked about many times. Now, I was her employer, but I also considered her a friend. And in this case, these roles were kind of like connecting for me. But my first thought was really like, this is somebody I'm concerned about, I'm connected to. I went right over as soon as I could to the bridge, and I had been in communication with her. She had stopped texting at a certain point, and her both her boyfriend and another family member were very concerned because she wasn't responding to their text. And fortunately, I was walking on the bridge, and I ran into her, and we had some conversation, and she was very grateful that I was there. And she came back to my house, and we spent some time, and invited her loved ones over. And she struggled with a lot of suicidal intensity for the next few days, actually next couple of weeks, and ended up admitting to herself to a residential treatment facility. But the point is that, in that moment, I was able to offer something which was not a professional response, was not sending the police, and was not about demeaning or diminishing her agency in any way. And this is a really great example, I think, of how, peer support, when we meet people on an equal level, understanding and not judging where they're coming from or what they're going through. We have an ability to connect with and support people in ways. And a lot of that also is about having that shared experience myself, having survived suicide attempts and then lived with suicidal thoughts and feelings for a long time. I knew what it was like to be there, and to want to take a lethal action.
So in working with the professional sports league, we determined it was a very oh gosh, such a macho environment. I thought it probably would make the U.S. Armed Services look like a support group. The way that the locker rooms of this organization worked, very, very, if you're familiar with man rules, and very kind of testosterone-driven environments. So in having conversations with them about the issues around mental health and wellness, one of the things that we identified was just the inability to talk about things like mental health struggles and substance use disorder. So the goal at the very beginning of building peer support was to start to normalize the conversations and to explain to the gentleman how important it was to be able to listen to one another. And what we actually did in this particular situation, and the reason I'm using it as the example, is we, you really have to figure out what it is that's going to speak specifically to the people you're working with. And for these gentlemen, what we decided on was we told them that this was the vulnerability was the ultimate form of strength, because it's so much harder for the hypermasculine in an environment like that to admit frailty and that they need help. So in admitting that they needed help and in frailty, it took true strength. So the goal that we had was to create an environment where that became the norm and people could talk. And of course, it didn't happen across the board, but you have a couple of people who have lived experience who step up. And before you know it, you've got a small little group of folks who everybody knows they can go to ask questions for. And then when something happens, and in this particular case that I'm thinking about, it was a substance-driven mental health crisis that resulted in a pretty acute, well, the person got very, very close to suicide. And the beautiful thing was not only, well, the intervention took place outside of the peers, but the really beautiful thing was when the individual came back to be with his peers. They were ready to greet him and to help reintegrate him. And I think that's one of the most remarkable things about building a real peer support community is they can certainly intervene crisis on the front end, but they can help to reintegrate someone post-crisis on the back end of it.
Well, thank you. And so we're going to talk a little bit about what makes peer support specific, and how it can work in various different ways. Peer support, as you probably know, is kind of practiced in some form, informal form, almost every day, everywhere. As you know, my neighbor helping me fix a car is peer support. People share child rearing responsibilities, etc. A lot of peer support happens, in break rooms, around coffee rooms, often in informal places with regard to workplaces, or in meetings, happy hours, local events, etc. On a structural level, when we talk about peer support programs, there's a few different types. There are casual peer support projects, things like, closed Facebook groups, things like that. There's sometimes organizations or groups will have like a kind of a buddy time, or like nowadays, a lot of people are doing sort of Zoom-based kind of meetups that aren't specifically about a specific issue. And then, of course, there are support groups for people with all sorts of specific kind of struggles or challenges as well, whether it's cancer survivors, domestic abuse survivors, people living with ALS. All these different groups have different forms for peer support. Now, when we start to talk about implementing peer support at the workplace, usually we're talking about something that's a little bit more on the structured side, things that kind of operate programmatically within an organization or across a community that require a little bit of setup, but can also be very much community driven. A peer buddy project, or a peer project in which individuals have kind of like, sort of standing by to help others is a classic example. A warm line or a phone line that exists for individuals to connect with others. On the more structured side, peer support groups are very commonly known, and in the US and other countries as well. Things like 12-step programs have a structure to them. They happen at a certain time and place. They have a kind of a format. There are kind of rules guiding how those things happen. And this is very common in all sorts of different peer support groups. The point is that they're structured rather than kind of casual, even though they really embrace and embed the peer support principles. So peer mentoring is another form of peer support in which an individual is identified and provides kind of one-on-one peer support. Usually this person has training. That level of support kind of reaches its industry height with what we call peer specialists, who are highly trained, actually mental health professionals in most cases. Peer support is found around the world in all sorts of places, some that you would know, some that might surprise you. There's been a lot of growth, and Sally's been a part of developing some amazing peer support projects for first responders, fire, police, all these organizations and industries that are really susceptible to high levels of mental health struggles and suicide as well. Construction industry, we've been working a lot in that area recently, and among all sorts of folks, peer support programs are pretty much a very integrated system. This has really been true among the military populations and veterans, including the VA, et cetera, which have developed a lot of peer support programs. So what do peer supporters do? Well, they create and care for a compassionate relationship. Peer supporters are not and don't necessarily have to be mental health professionals by any means. Sometimes it's better if they're not, actually, because peer supporters are about meeting others on their same level. Peer supporters listen effectively to make sure that the other person feels heard. Feeling heard is a very powerful and important validation, regardless of what you're going through. Peer supporters are not there to give somebody a mental health diagnosis, to judge their situation. What they do is they seek to understand. A peer supporter will explore solutions and resources with their peer. They're not a service provider, they're not a resource provider. Although, and that's a really important part of the thing, because a peer supporter is about being with someone where they are, going through what they're going through. It's not about telling them what they should be doing, etc. Peer supporters do not fix other people's problems. Going back to that other point, If we're equals, then we're going to explore your possibilities for your solutions together. I'm not going to give you advice. Peer supporters, like other things, that don't want to cross ethical lines, whether it's a financial or a romantic line or this sort of thing. When you're in a peer support mode, you want to be really respectful of the other person's integrity and make sure you're not introducing things that complicate that. Peer supporters do not provide psychotherapy. And it's really important, I think, to avoid what we call the therapy zone. In our trainings at Humanivations, we do specific stuff specifically about that, which is peer support is not about psychotherapy. It's not about exploring deep wounds or this sort of thing. It's really about staying focused in the present and maybe in the near future. And peer supporters do not give advice, as I said. So action steps and resources. What you can do today to think about implementing peer support at your agency or within your community or your association is find out a little bit what's happening now. A lot of places actually have some kinds of peer support type things, or even like initiatives that you might not even know about. Connect with others who can be champions for this issue within your organization or within your community, people who seem naturally inclined to this stuff. You can review and learn about peer support models from us, from some resources you'll see in a little bit, and engage with employees and people who have lived experience in these discussions to talk about what would help, what could we bring, what could we develop as a community that would be driven by the community. Finally, get people together with a little action team, plan for your next steps, and see how you can build peer support to provide an amazing new resource for your community.
So in closing, we have some resources here and some references, some examples of model peer support programs. And in the last slide, we just call you to action to take the pledge. Go to workplacesuicideprevention.com and take the pledge to make workplace suicide prevention a health and safety priority.